Sujok. Feels interesting or not? It is very logical, interesting and result oriented. See, among many benefits of Sujok, one is the benefit, it is result oriented. Result oriented. Most of the cases you can get results if you have achieved a certain level of understanding and perfection. Especially in the postmortem system. I am fan of postmortem system. Postmortem system. If you are really good at postmortem system, Professor Baju used to say, postmortem system never fails. Like that. Other system of Sujok, like energy flow therapy, 6 treatment, triological consciousness treatment, mood study, it requires your good understanding and decision, not in a particular case. Then, if your decision is good, then only you can get the good results. Not only decision, at the same time, your consciousness. I told you, subjectivity is involved. In other methods of treatment, most of the other methods of treatment, subjectivity is also involved. That means your consciousness is also important for the purpose of treatment. And to tailor this consciousness, it is not an easy task. It comes with lot of education, lot of experience, and lot of understanding. Consciousness, training of the consciousness. But this method of treatment, it is much decision is required. Only decision required is to go to this related postmortem area, find the painful point, and just apply the treatment. No your other decision and that pathological condition, whatever the disease, we are not bothered about the name of the disease in the postmortem system. In the postmortem system, we know disease is related to the heart. Whatever the name of the disease of the heart, we are going in the postmortem area of the heart and treating the heart. Finding the painful point and treating the heart. So this is the easiest method of treatment. And at the same time, high potential, very high potential. I told you in the quick acute conditions, in the most of cases, in the acute cases, most of the cases you can get instant relief, instant. This is also one of the most benefit. It is otherwise result oriented, that means in chronic condition as well as acute condition, it is useful in both of conditions, but chronic conditions takes longer period of time in getting the treatment. But acute conditions, this is your responsibility. In acute condition, if you start applying the treatment without wasting time, then you are winner. And it looks like magic. Without medicine, without anything, I explain some of the my personal experiences to you, share with you, my own cases. So immediately, see what happens if it happens and you waste the time. That means if anything happens just now, if you do it immediately, improved immediately. But you got some injury now and you are trying in the evening, then you need little bit more efforts. But when it is taking place, for example, headache just started, you immediately start. Gone. But headache started and by the time it gained power, then you need extra efforts to treat that condition. But it doesn't mean that it does not improve in that condition also. But if that condition also improves, but you need little bit more extra efforts, good understanding, good perfection. But in otherwise, acute cases, I yesterday told you that if your own self-assessment procedure, that how you can assess that whether you are learning this, what you have learned in a proper manner and you are capable to implement in a proper manner. Your self-assessment I have given. And what is the self-assessment? First, a capability to achieve pain management. In more than 70% cases, you should be able to control any type of pain which one can suffer during the life. Anybody's pain, not your own pain, your family members. Sometimes even I have tried 3 years baby, 2 years baby, 1 year baby, which even cannot express. But by just gesture, just like touching here and here, crying, and I know what level, what area baby is having the pain, and I immediately just give massage on the postmanous area. Improve. So pain management is the very effectively you can manage if you know the postmanous system. Pain management. And another criteria I am giving you for your self-assessment in acute diseases. Even if it is pain or anything else, in acute conditions, you should achieve very good results. Very good results. And third criteria is also one more third criteria, that in overall conditions, that means if you get a number of patients, 100 number of patients, your result should be more than 50%. If your patients are getting treated only 50% or less than 50%, that means still you have not learned properly level 1. In level 1, your treatment results should achieve more than 50%. That is your self-assessment criteria. That means if you are not getting the results up to the 50%, that means only few of your patients are getting cured and not much of the patients are not getting cured, then you have to consider yourself. You have to ponder upon your own understanding. You have to study more. You have to try more. So this is this self-assessment criteria I have given you. See, in last 2 days we have discussed about the first history of the Sujok. In history, I now feel that I made a little bit mistakes. Perhaps I told that this Sujok was first introduced in medical journal by an article by Professor Palju. I think I told 1984, but it is 1987. First article. See, Professor Palju started to work on Sujok before that, long before that. But official Sujok, official means first some in media coming something. It is 1987, February 1987. So I told you history of the Sujok, how it developed, and during this short period of time, it is spreading in large number of countries. It is practiced worldwide. And in India, at least 2 lakh practitioners are there, at least, minimum. In every city you can find practitioners. At least 2 lakh practitioners are there in India. So this is such a spreading, and not only, I told you, it started from the postmandial system. That means only that method of physical method of treatment. Thereafter, lot new information, numerous, big amount of information was developed by Professor Palju by name of energy systems and trivergent consciousness system, twist therapy, smile meditation, Sam Dong, smile Tai Chi, lot of systems were developed, and which is equally important in our treatment procedure. So when we want to learn Sujok, that means step by step. Again, step by step, I told you importance of the level 1, because level 1 importance is that without any special background, without any special educational condition, without any special your knowledge level, you can learn and start practicing. I have students of 10 years, only 10 years. During some vacation classes, some parents who already learned Sujok, they send their children. 10 years. I have students of 80 years plus also. And they both can successfully learn and apply. That means age is not criteria, education is not criteria, only your learning speed is the criteria. That means your sincerity is the only criteria. There is no excuse that I don't know the anatomy, I don't know this terms and anything. I told you 10-year boy does not know anything, and he becomes hero of the class. Because even teacher sometimes have problem, she treats the teacher. He treats the teacher. So there is, if you are not learning and getting results, that means something you have to analyze yourself. System acts at its own power. That means you have to be very serious, attentive to this subject and start practicing. So this is the benefit of Sujok, that without any special background you can have. So I said result oriented. Always result is there. Always result is there. Sometimes less, sometimes more. It is another issue. But most of the time results are there. So result oriented subject is this. Then we learn about how this Sujok is developed, physical system, metaphysical system. In the physical system we divided united correspondence system and individual correspondence system. Individual correspondence system further divided, and we learn standard correspondence system. Standard correspondence system of hand and feet, and at the same time we classified it as primary correspondence system and secondary correspondence system. Standard correspondence system before learning the external correspondence system, we started to learn about the similarity of the hand with the body, and it is quite evident similarity in number of protruding parts, lever of location of protruding parts, proportion of protruding parts, direction of protruding parts, number of segments joined, similarity with the yin and yang surface, similarity with reference to the line of symmetry dividing in equal two parts, as well as similarity in reference to the relation of the 5 protruding parts with the line of symmetry, and finally thumb is head. That was similarity. It clearly proves that this correspondence system or the head has been made similar to body with a certain intention and the purpose, and that purpose is only about our health and happiness. Health and happiness, they are like two parts of one coin. If you are healthy, you are happy. You cannot you are sick and you cannot be happy. So therefore, health and happiness are one thing. Only point of view is different. Health. So therefore, it is only for the purpose of our health. And how to use it? I told you that when we know the similarity of the body and we know the information of the body, that means know the body, internal organs and information of general information of anatomy of the body, and just to start transferring the body image over here in the head, and then start using the system. So for using the system, we have to know 3 things. That means know your body, know the reference lines, and know the 6-step procedure. Know your body, I explained first day, and also yesterday again I have shown you all the slides of the anatomical pictures. So the better you know the body, better you are in a position to use the correspondence system. I want to tell you. So second is reference lines, and reference lines also very importantly important for our proper use of the correspondence system, because they make us to find the correspondence area in a correctly, in a precise manner. Otherwise, we may make the mistake to find out the correspondence area. So we use there are reference lines, 3 types of reference lines, but two important, which is important, central line and diaphragm line. Rest is the additional reference line. We are creating some more criteria to make our searching procedure more accurate. Rest is the additional. Additional, you can create many according to your judgment and the choice. Out of which I have given one to divide the abdominal cavity in 3 parts. But who is the important? One is central line. Central line in the body is running from the top of the head up to diaphragm and flowing down up to the center of the trunk, in the bottom of the trunk. It can be seen from the front and back. So therefore in the hand also we have line of symmetry. What is that? Dividing the thumb in 2 parts, and then just putting the one guiding point in this triangle made by the palm lines, and then meeting, and from this point, this is called jugular notch, this point of the neck pit point, this is called jugular notch. Medically it is called jugular notch. From this jugular notch, go straight in the triangle line, and from here again go down between 2 fingers. So this becomes your yin surface central line. Yang surface central line, again divide the thumb from the yang surface in equal to, and then from this point slide down first, check, and just below this first metacarpal bone you will find the pit near the wrist. Put a point in this pit, and then from here join this line. Then put one point over here. Put one point over here, that means between 2 middle fingers in the hand, and then move up, remaining in the center of these 2 fingers, and when you reach the wrist, again you find a pit here. So put a point in the pit and then join this line. So this becomes yang surface central line. This becomes yang surface central line, and this central line is used to find out the correspondence area of the right side and left side of the body. That means we are not thinking in terms of the hand. We are thinking in terms of the central line to find out the right side and left side of the body in the head. And what is important about this question, right side and left side of the body is decided only by the front, not by the back. Even yesterday when I asked the question, people are still doing like this, like right this and left this. Right side and left side is decided only by front. And then what is the right side in the front? Behind that is the back side of the right side. So this is the reference line, central line. Then second reference line is diaphragm lines. And diaphragm lines are two types. Lower line of diaphragm, upper line of diaphragm. Upper line of diaphragm is used to identify the corpus area lying above the diaphragm. So how we find it above the line of diaphragm? Because we know, I explained, because of the displacement of the thumb. What happened? The chest area also got merged in the abdominal area. So what happened? Upper layer of the diaphragm as well as one side of yin yang division line also got merged in the abdomen, and which finally became our lifeline. So our lifeline represents two things. Number one, upper line of diaphragm, upper layer of diaphragm, as well as one side of the yin yang division line of the thoracic cavity. One side of the thoracic cavity. So therefore, how to find it out? So from the central line, again thinking the central line, when this central line is passing over the lifeline, crossing the lifeline, this middle point of the crossing, point of the passing over become the center of the diaphragm. From this center of the diaphragm, we find a yin yang division line in the line of the thumb. In the line of the thumb, we find the yin yang division line in the bottom, again near the wrist. And then from the central point, we join this yin yang division point, this becomes half diaphragm. And from this half diaphragm, the same length we extend on the lifeline opposite to this central point, opposite side to this central point, and this becomes full upper line of diaphragm. Same in the yang surface, the point which we put in this pit here, this becomes center of the diaphragm. From this center of the diaphragm, we draw a line up to yin yang division line which we already have created. And this length we extend in the opposite side, and this becomes upper line of diaphragm on the yang surface. This is upper line of diaphragm. Lower line of diaphragm, very simple, very simple. This first wrist fold from the palm side, first wrist radiocarpal joint, it is called radiocarpal joint medically. So this first joint, this becomes lower line of diaphragm in the inside, and the same line when I extend in the back, this becomes yang side. What to keep in mind? When the yang side, when we are making this should pass over this point of the pit here. We have this one point, this line should pass over this pit. If it is passing through this pit, that means you are correct in the yang side. Because in the yang side there is no identification, no folding. So therefore we have to create in a proper manner. So this is lower line of diaphragm of yin side and yang side. And then we also discussed about the additional reference lines. Why additional reference lines? Because in the abdominal cavity we have so many organs. So to identify the correct location of these organs, we have divided the abdominal cavity in three parts. So similarly we are dividing in palm in three equal parts by two parallel lines. And this which is near to the wrist, we call it upper part, then middle part, and close to the fingers, we call it lower part. So this is three segments of the abdominal cavity. In upper part we have from the right side starting liver, gallbladder, then it's coming in the left side stomach, then extreme left side spleen, and then behind the stomach but lower side is pancreas. Then in the middle part, starting from the right side, ascending colon, then transferring this side become transverse colon, and in the left side it is descending colon. So this is middle part. Lower part in the right side, appendix. In the left side, sigmoid colon. In the center, rectum. This is the remaining part of the large intestine. Then in the center again, urinary bladder. Center again, urinary bladder. And male and female reproductive organs. In the case of male, prostate and testes. And in the case of female, ovaries and uterus. So yesterday when I asked you how to find out uterus, then I explained everybody. Uterus you can find in the center. But how to find out ovaries? Because almost everyone was wrong in the ovaries. So what is the criteria of finding the ovaries? Draw a vertical line between these two fingers. And then draw a vertical line between these two fingers. And now touching to this is the ovaries. Now touching to this is two ovaries. That means ovary is lying between this joint. This joint, you in the palm you have joint of this finger, this joint and this joint. Between this joint, one ovary is between these two joints. So therefore, how to find out? Draw a vertical line here and then draw this line, and you can find the ovaries. So you have to do it in a very proper manner. So this is ovary inside uterus. So not difficult to find it out. So ovaries and uterus I have. And how to find out prostate? Then you know your urinary bladder, and below the urinary bladder, prostate. And in the bottom is testis. Because external genitals as well as testis is overlapping at one point of time. At only one point. So therefore, we find in the bottom is the testes as well as external genitals. Above that, prostate. Then urinary bladder. So you can find out this. See, this is very important in the males especially. Prostate. Lot of problems after 60s people start at prostate. And it is very effective if you treat. But if you are treating at wrong place, how you can do? Many people in the night, regular urination, 6 times, 7 times, I just made them educate, just give the massage here. After 6-7 days they report lot of improvement, sir. Lot of improvement. But depends upon your right decision, if you are doing at the right place. So this is how we are finding the area over here. So this is our, this side, inside. In the yang side is what? Spinal cord. And the spinal cord 1 to 7. But where is the 7? 7 is the projection of this bone. Because here is also 7 is the most protruding vertebra. Most protruding vertebra is 7. You can even feel 7 is coming little bit up. 7, you can feel here. This is 7. So same, this projected part is 7. And then here 1 to 8. This pit, point in the pit, it is 8. Point in the pit is 8. So here again, point in the pit is again 8. Because through diaphragm, point in the pit is again 8. And then after that, we have thoracic 9 to 12, lumbar 1 to 5, sacrum and coccygeal region. So how to find it? Divide in 3. This length, that means this total length we divide in 3. And then first 1/3 is thoracic 9 to 12. Second, number 1 to 5. Third is sacrum and coccygeal region together. How to difference? Remaining 1/3, 1/5 is sacrum. From top 1/5 is sacrum and remaining is coccygeal. So you can decide this way also. So that is remaining bottom 1/3, 1/5 is sacrum. And then remaining is coccygeal. So this is the how we are finding the corpus area. So this way I explained how to find the body parts over here. I give this all these parameters. I give the superficial parameters. How to think about the face. Face, pituitary, just 1/3 is the pituitary. Above that is hypothalamus. Pineal is in the level of the pituitary, but deeper inside. So therefore, coming in the yang side, then we decided about the neck. How to decide? Esophagus and trachea in the center, but esophagus is in the back, trachea is in the front. So if you want to influence on the esophagus, your pressure should be little deeper, because upper surface is trachea. Esophagus, for example, something problem in the swallowing food and like that, then your pressure should be deeper to create influence on the esophagus. Esophagus is the back side. Then coming down, then in the neck, we divide the neck in the third part, third division. Top just joining the, touching to this joint, but coming down, touching to the joint, but lower side is tonsils. Then thyroid is lower 1/3, lower covering entire area of the lower third. So how to find the lower 1/3? First find this joint, exactly, fold. Then divide this fold to this joint, 3 parts, and then you decide the thyroid gland. And on the thyroid glands, you find the parathyroid glands. Then we came in the chest. Chest, for thymus, we divided the chest in 3 parts. And where is the thymus gland? Upper 1/3. But upper 1/3, because it is long, so it is not in the upper 1/3. That means part in the upper one third, part in the middle. Yesterday I drawn everybody's head because it is long. So therefore it is a level of the one third, but some part is going above the one third, some part is going below the one third. Then how to find out the heart? We divided in half. So little less than half. So even you consider half, no problem, because at least you are not missing the heart. Heart is very important. You should not miss the heart. So now this is how to we find thoracic cavity. Now abdominal cavity, what the criteria we have kept? Navel. What landmark we have created here? Navel. So this central line, that means middle of the central line is navel. Middle of the central line is navel. And then above the navel area, below the navel area you can find out. And the bottom part of central line is your genital area. Genitals. So therefore we have created these landmarks. These landmarks you can find out in a proper manner. In the back side also one organ, kidney. Kidney. How to find out the kidneys? That means just taking two fingers and going up until you find the bone. And just below the bone is kidney. Then another kidney is where? Take last two fingers and again do this same procedure. That means kidney, you keep moving until you find the bone. And then finally you find the bone, and just below the bone you can clearly feel a pit by the tip of your finger. Very clearly you can feel this pit by the tip of this finger. Above this pit there is bone. So you cannot go above this pit because this is final soft area. This is the last soft area of this line. So above this it is bone. So just remaining below the bone is kidney. And then adrenal glands are lying on the bone because they are attached to the kidneys. So this is position of the kidneys and adrenal gland, which also I explained and I repeated again. But finally I have given some clue also. One clue was given about the adrenal gland massage. How to do the adrenal gland massage? That means putting the finger in the kidney, pressing inside, and then giving your stroke, rubbing stroke where? On the bone. So it becomes massage of the adrenal gland, and I explained about the utility of the massage of the adrenal gland in any anxiety situation, any anxiety syndrome, or even in any sort of emergency for the body. Whether it is physical emergency or whether it is the emotional emergency. Sometimes we are in emotional trauma, sometimes we are in physical condition. So immediately this is, even I told you, in unconsciousness. If somebody is fainted or unconscious, we want to recover, regain the consciousness. So adrenal gland massage is one of the good procedure. So adrenal gland massage, I explained how to do it, adrenal gland massage, and time is not criteria. You have to do it regularly until there is an improvement. Or if you cannot do one time for a longer period of time, repeatedly with breaks. So this is adrenal gland massage which I explained. Then I also explained about the diabetes exercise, pancreas. How to find out pancreas over here? Pancreas is little bit starting from the central line to the right side and then below the bottom, down the behind the stomach, but in the lower area of the stomach, and then little bit going up. Not like this. It is not like going like pancreas is here. For example, pancreas. It is not going like this. Not start like this. But from starting and little bit going up. So therefore this criteria should be kept in mind, and I explained that these four fingers become like size of pancreas in your hand, and put the finger on the pancreas, little bit making this angle, and then finally don't do straight away. First check by pressure. Who have diabetes? Then you check yourself. Can you find the pain? If you have diabetes, you must find the pain by this pressure. Can you find it? No, that means you are still not able to search it. Not able to search it. See, this is approximately area. Then I told you, Whenever you do any activity, some sort of support is necessary. When support, then I check whether strong or less. Strong. Because diabetes, it must be painful if you do this. So see where I am putting 1/3 and then little bit making angle and then giving support back side and then pain or not pain? Pain always. If you are, see, this is the rule of the correspondence system. Disease is always expressed by way of pain in its correspondence area. Why? Because in the correspondence area are created correspondence balls, which are the painful to any external stimulation. So therefore, we compulsorily have to find the pain first. Treatment is next. First find the pain. Treatment is next. You cannot start, if you are going straight away for the treatment, you are missing the treatment actually. Finding the pain is the most important condition. So when you find the pain, and then I explain how to do it 10 times. But 10 times not like this. That means pressing and according to your painful capacity, holding up to counting of the 10. Then releasing. Then again 10 count here and 10 times here. Both hands before taking any meals. Before. I guarantee if it is a marginal case, if it is like a not very advanced and insulin dependent type and medicine dependent type of case, you will be able to control the diabetes. You will be. So we explained about the diabetes also, or diabetes exercise. Then also we discussed double correspondence systems. Many double correspondence systems in the body we have. And among that, first important is about the legs. Legs. In the leg, when we are standing position, see, before that again I want to invite your attention to the definition of the yin and yang surface. Yin yang surface definition, body has to be seen in the animal posture. And when in the animal posture, outside becomes yin. Yang, sorry. Inside become yin. So, for the body, rest of the body, outside and inside is the same. For rest of the body, outside and inside is the same. But for legs, what happens when I am standing up? So this part of the leg goes inside and this part of the leg goes outside. In that condition, yin-yang division line is passing from the front of the kneecap. Where it is passing? Front of the kneecap, yin-yang division line. And in the sitting position, what happens? What happens? Yin-yang division line is now shifted to the sides. Earlier it is in the front. Yin-yang division is standing position in the front. Sitting position, yin-yang division line become in the sides because this become outside, full kneecap become yang. Earlier what happened? Half kneecap is yin, half kneecap is yang. But in the sitting position, full kneecap become yang. So according to situation, we have to do? We have to match our finger accordingly. That means in the standing position, we are taking the respective finger. That means if it is right leg, I am taking this finger. If it is this leg, I am taking this finger. And then matching the surface of the finger according to the position. In the standing position, I am matching like this. So in this condition, this becomes yin, matching to the yin. Yin matching to the yin. Yang matching to the yang. Yin-yang matching to the yin-yang. And then I can find the related correspondence area of the disorder in my leg. For example, I have pain over here in the standing position. Then I will find it over here somewhere. Or I have pain here. So where I will find? I will find on the yin-yang division line. But when sitting position, everything will be then compared in this position. In sitting position, what I will do? I will just turn my finger in the sitting position and then start comparing the knee like this. Knee like this becomes sitting position. And then this become full size. This become yin-yang division lines. And down becomes yin side. So depending upon the manifestation of the disease, how disease is expressing itself during activity or walking or during climbing, that means standing position. During sitting or keep sitting or while getting up by sitting, then sitting position. Sometimes disease can happen in both conditions. There can be such a condition also. Patient suffering from while walking also, while sitting also. In that condition, you have to treat two areas. That means one disease, 2 points. That means you have to treat over here also, here also. 2 points has to be included in when disease is manifestation is in both conditions. So this was the double correspondence area of the legs. But this